Some men are injecting household substances into their penis to try to get more girth, and the medical consequences are genuinely horrifying. I want to be clear right from the start. This video isn't here to shame anyone. The desire to feel more confident about your body is completely human, but there is some deeply dangerous information circulating out there. And it's my job to tell you the truth about what these injections actually do, because the research is alarming. I'm Dr. Julian, and today we're covering the real history and real dangers of penile injections. Let's start somewhere surprising. The idea of injecting substances into the body for cosmetic or sexual purposes isn't new. It goes back well over 1,000 years, with references appearing in some of the oldest texts on human sexuality and medicine. But the first documented medical disaster from this kind of injection was recorded in 1906. Doctors at the time were experimenting with paraffin, a waxy substance, to smooth out facial wrinkles. It seemed promising. Then patients started developing hard, disfiguring lumps under their skin. By 1917, the same outcome had been observed, with mineral oil injections, grotesque nodules, permanent disfigurement. The medical community stepped back and said never again. And yet, decades later, men started doing something remarkably similar, just in a very different location. Here's what the modern literature actually documents. One of the earliest cases involved men injecting cod liver oil. Yes, the supplement, directly into penile tissue. What followed was severe, infected fluid pockets beneath the skin, inability to retract the foreskin, and in some cases, necrosis, meaning the skin literally died and turned black. No cosmetic goal is worth tissue that turns black and dies. Then there's the Vaseline cases. There's a well-documented study looking at a group of Hungarian prisoners who collectively encouraged each other to self-inject Vaseline for girth enhancement. The outcomes? Even in men who didn't suffer obvious acute complications, the large majority reported they were unhappy with their results. And for others, the consequences were severe: erectile dysfunction, urinary difficulties, and grotesque penile deformities. Here's the part that should stop anyone cold. These complications can show up decades after the original injection. We're talking up to 40 years later. 40 years. A choice made at 25 can still be destroying your quality of life at 65. The largest study I've come across on this subject reviewed 680 men who had undergone some form of penile injection. The numbers are staggering. More than 84% reported significant pain. 83% experienced swelling. Nearly half developed hard, fibrous plaques. 1 in 5 had pus draining from the injection site. And over 12% developed open ulcers on the penile shaft. 75% of those 680 men eventually needed surgery just to repair the damage. 3/4 of them ended up in an operating room because of a decision they made, trying to feel better about themselves. That number is not a rare complication rate. That's essentially the expected outcome. Now, I want to be fair. There are a small number of injectable agents currently being studied in clinical research settings. Some early results are cautiously interesting. But cautiously interesting in a research setting is a very long way from safe and recommended until we have solid, reproducible evidence. With long-term safety data, I cannot in good conscience point anyone toward penile injections as a solution for size concerns. If this is something you're genuinely worried about, there are real conversations to have with a qualified urologist. You deserve honest, medically sound options, not a syringe full of petroleum jelly. And a hope. If this video helped clarify something you've been wondering about, I'd really appreciate it if you gave it a like. Helps Dr. Julian keep making content like this. That actually tells you the truth. And leave a comment below. I do read them. Take care of yourself. You're worth more than a dangerous shortcut.